morning, everyone. Let me present my PhD topic with the title New Insight in Cachexia Prevention in Gastrointestinal Cancer. My name is Bettina Budai. I am a dietitian and a first-year PhD student. Currently, I am working at the Semmelweis University at the Division of Pancreatic Diseases. My vision is that nutrition is a cornerstone in the multimodal care of all cancer patients. And my mission is to carry out scientific activity to bring innovation in the nutrition therapy of cancer patients. To complete my mission, I have two specific goals. One is to investigate the risk factors for malnutrition in patients with gastrointestinal cancer. And the second one is investigating the effect of amino acid supplementation in gastrointestinal cancer patients. Let me introduce my first topic. The prevalence of malnutrition in gastrointestinal cancer is up to 30 to 90%, depending on the tumor site and stages. The definition of malnutrition is an altered body composition due to inadequate nutritional intake. It means a negative energy balance parallel with inflammatory activity, and it has a great negative effect on the cancer and the anti-cancer therapies as well. It is multifactorial. That means that there are various risk factors that can contribute to its development. The presence of malnutrition can significantly worsen the prognosis, decrease the overall survival, and increase the financial burden on the healthcare system. Moreover, the exact causes and mechanisms has been unknown as well. To take into account this fact, our aim is to investigate the risk factors for malnutrition in gastrointestinal cancer. The clinical question is, what are the risk factors for malnutrition in patients with gastrointestinal cancer? The framework of this topic is a PICO. We are going to investigate patients with gastrointestinal cancer. Exposure is the presence of the risk factors. It can be, for example, age, gender, or the stages of the cancer, or the presence of The C is the absence of the risk factors, and outcome is the malnutrition. Our hypothesis is that risk of malnutrition development is increased by specific clinical and biological factors. The clinical implication is that with the early detection of the patients who are at high risk of developing malnutrition, we can delay the development of it, and we can improve the prognosis and the quality of life as well. I conducted a systematic search on 21st of October this year in 3 databases. You can see the final search key. It contains 3 domains. The first one related to the digestive tract, the second one related to the cancer, and the third one related to the malnutrition and the nutritional risk screening tools. After the manual and automatic duplicate removal, the final number of hits was more than 20,000. We finished the title and abstract selection and calculated the Cohen's kappa with the result 0.88. Finally, we identified 1,555 eligible studies based on the title and abstract. For the full text selection, with my co-investigators created a 3 selection group, and currently we are working on it. Let me introduce my second topic with the title Investigating the Effect of Amino Acid Supplementation in Gastrointestinal Cancer Patients. This project started this year in November. At the diagnosis of cancer, all patients have to be screened for malnutrition and offer nutritional support as needed. The presence of malnutrition in patients undergoing oncological treatment can increase the toxicity, decrease the performance status, quality of life, treatment response, and overall survival. There are insufficient data for the indication of amino acid supplementation in cancer patients. Some data suggest to indicate branched-chain amino acid to improve the fat-free mass. Some suggest to indicate glutamine to prevent mucositis. To ensure a proper indication, our aim is to evaluate the efficacy of amino acid supplementation in gastrointestinal cancer. The clinical question is, what is the efficacy of amino acid supplementation in gastrointestinal cancer patients? We created for it a PICO framework. We are going to investigate patients with gastrointestinal cancer. I is the amino acid supplementation, C is the absence of this intervention. outcome is the nutritional status, quality of life, and survival. Our hypothesis is that amino acid supplementation can improve nutritional status and quality of life, but does not improve prognosis in patients with gastrointestinal cancer. The clinical implication is the proper use of amino acid supplementation in GI cancer patients. As a summary, I would like to say the submission date for my first project is next year May, and for the second one is next year July. I would like to finish my presentation with a quote from Benjamin Franklin: "Tell me and I forget, teach me and I remember, involve me and I learn." Thank you for your kind attention.
Thank you for the presentation. It was very good. I would like to ask you that what kind of amino acids will you examine in this second project?
Thank you for your question. I plan to investigate glutamine and branched-chain amino acid, as I mentioned, for example, leucine, isoleucine. These are the most common amino acid supplementation that is used in the treatment of cancer patients.
Thank you for your presentation. I would like to know how you're going to separate the amino acids effect, because sometimes there are supplements that have arginine and glutamine and other kinds all together, and how do you plan to analyze them individually, or if you do not plan on doing this? Yeah.
Thank you for your question. So we are planning to investigate mixtures as well, as you mentioned, and I think we are going to do a subgroup analysis for this.
We have to investigate in subgroup analysis the stage of the cancers, and I think the organs, because I think, for example, gastrointestinal, colorectal cancer is absolutely different. Pancreatic cancer, liver cancer. So, if you will have enough data, I offer you group analysis based on the stage and the part of the gastrointestinal tract.
Yes, thank you for your suggestion.
So, thank you for your presentation. My question is, how do you make sure the effect of amino acid, since there are many food that may also include this amino acid?
At this stage, we identified the key articles, and it was all of them were randomized control trials, and it's always was an intervention if they indicate a higher amount of amino acid, higher than it contains in the food or other sources.